Hi everyone, welcome to another Homespa Beauty podcast. I am so pleased to bring you an interview today, and it's with Jasmin Thomas, who is the co-founder of Ohana Skincare. Now, I didn't know a lot about CBD in skincare, and Jasmin's got a fantastic story that explains why she felt there was a need to bring these products to the market. Her backstory is really something else. I hope you enjoy it. And other than that, I don't want to give away anything. I want you to enjoy hearing about Jasmin's story, hearing about the brand, where it started, why it started, and where it's going. And believe me, you will be inspired. So, Jasmin, it's so lovely to talk with you. I have read quite a lot about your story, and I'm fortunate that I've had the chance to try the Daily Defence Serum. I'd love to hear your story and for you to share a little bit of it with us, just how you got started and where everything led you to begin the range.
Okay, cool. Thank you so much for having me. I'm so excited to speak to you today, and I am so happy that you like the Daily Defense Serum as well. It is one of my favourite products. So the story really started in 2015. I was diagnosed with an autoimmune disease called multiple sclerosis, so often called MS, and it basically means that I have a degenerative autoimmune disease that affects my brain and spinal cord. So this sort of disease affects people in different ways. At that time, it really affected like my legs, memory, and I got something called Lermit sign, which is sort of like this vibrations down the spinal cord. And I kind of discovered I had it because I actually went deaf in my right ear, and I didn't get seen to for about 6 months. I was like, oh, it'll come back, it's fine. And then it didn't, and then there was nothing wrong with my eardrum or anything like that. And they were like, oh, maybe we'll send you for an MRI because it must be your brain. And then it came back as MS. So I was like, I've always been like quite an unrealistic positive person.
Yeah.
So I wasn't really that sad, to be honest. I remember getting diagnosed and my mum was crying. I was like, oh, I was like comforting her. And it wasn't. I was like, it's not happened to you, love. Calm down. And yeah, I was just kind of like, okay, well, I'll just have to find a way to get on with it. I was 25. I didn't really want to accept any of the disease-modifying drugs, just because, it was either like chemo that had like chemo side effects, or it was a drug that was going to give me a 30% chance of developing a thyroid issue.
Yeah.
And I had always come from a very like holistic, natural family. We grew up with a homeopath, so it was very, very like a second nature, like almost like, well, first nature, to be like, okay, how can I try and get on with this as naturally as possible? So it also just like coincided with me starting a new job the day after my diagnosis. And one of the first clients I was given was a pharmaceutical company, and they are the biggest medical exporters of medical cannabis worldwide. And the one drug they had available was called Sativex, which was specifically a medical cannabis drug for MS patients. So I had really good insight into working with the pharmacovigilance team, the scientists, the clinical trials, to really understand how cannabis could work as an effective drug for myself. And then I started using cannabis to manage the symptoms of my MS. So from there, it just became very much my passion, and I became very involved in the industry, and I started looking at other therapeutic benefits and what it could be good for. And then that led me to looking into it for topical application and skincare, and then discovering the benefit for skincare. And that is where I kind of like decided to combine my passions and start a company doing something that I was going to be wholeheartedly passionate about and give me purpose, essentially.
And what you've created, though, just having never created a range myself, but understanding what goes into it, that is some amount of dedication and the hard work. So, you found, have there been, you must be determined to make this happen. Have you found some of the challenges have been beyond what you expected, or have you taken them all and thought, right, that's fine, we'll work with that? You've never felt that anything's just been like, oh, come on, this is ridiculous?
Do you know what? I think it always comes back to like my unrealistic positivity, because I think that's just like what a lot of it comes back to, and having blind faith that it will all work out in the end, and never giving up. I think those three things kind of like culminate to what you need to be mad enough to do this, to be honest. Because I had no idea like literally what I was doing. But what I did use is like all my previous experience and utilize that in the best way possible. So the first thing I did was hire an NPD, which is a new product development specialist. She has 20 years experience formulating for some of the leading brands in the world. So not formulating, sorry, executing on what we need to do. So she was able to find our formulation scientists, our manufacturers, and making sure that we're being compliant, making sure we've got our PIF documents, making sure that we're insured. Everything from sort of like idea to product at the end, excluding branding and stuff like that. Then, she's got a really good experience of. So she was able to write out our critical path and really guide us through and give us options on what would work best for us and what kind of like collaborations was most well suited to the brand's values. So to be honest, that made it a lot more manageable, because there was someone that kind of like handheld me through the process almost. And there was obviously still like so much to learn. But that did make it a lot easier. But I just had some very unrealistic expectations as well. I went to the manufacturer and I was like, okay, I want this on the market in 6 months. And they were like, you're formulating from scratch 3 new, very unique products not on the market. This is going to take you 12 months. I was like, no, it won't. And of course, it's like 14 to 15 months.
Oh, but the sense of achievement you must feel, you must be so proud, because the product itself, just trying it, I think it feels lovely. The actual design of the packaging, everything about it is very, it's clear what you're trying to do, and even the information that comes with it. You don't just give us a product and say, here's how you place it on the skin. You actually recommend self-care, which is really unusual. I think that's a great USP. So you must have an amazing sense of achievement with what you've created.
I am trying to get better at that, because I think I was discussing, like yesterday, we had our first feature in Vogue, for example.
Wow.
And everyone was like, oh my God, that's amazing. And then they say, wow. But it's very difficult when you're in the brand and it's kind of like you're seeing it to get that overexcited. Because you're like, there is still so much that I want to achieve. But I always give the advice that celebrating the small wins are so important. So I did actually stop yesterday and made sure I celebrated it and made sure that I took enjoyment of that from that, and felt a sense of like being proud, because you do really have to celebrate the small wins to get you through. So that is something that I actually struggle with, to be honest, is feeling that sense of like pride and achievement, because I feel so far away from my end goal. But I am able to reflect on the last 24 months and be like, I have learned a lot. And I'm really proud of the amount that I've been able to learn, and the amount that I still surprise myself with what I'm able to do as well.
Well, Vogue is wow.
Yeah, that is good, right? I was like, oh yeah, this is our first feature in Vogue. Like, I really need to be proud of this.
It's a good one. I'd definitely say be proud. And the CBD element, I'd mentioned before that it's something we've all heard of it. I think I'd be surprised if anyone hadn't heard of CBD, but so many of us, either we haven't used it, or you'll know yourself, you see a lot of these adverts online. Quite a lot of the time, it might be something that's maybe not, sometimes on Facebook you see these little adverts and you think, is that a legitimate thing? And it might be like a supplement or something. This is completely different, isn't it? This is for your skincare. If you can tell us a little bit how the CBD works within the skincare.
So I obviously started using CBD to work internally, which is, for a condition like my MS, like taking it internally is definitely the best for the therapeutic recommendations. However, there are a load of benefits for the skin as well. So I first started using it topically for the analgesic effects. So I used to find it really, really helped alleviate the kind of like the pain and the tightness that came along with having MS. So since then, obviously, I've done a lot of research and then spoken to a lot of CBD formulation scientists. And we have something called the endocannabinoid system. So it is essentially like our immune system, basically. So it is a structure that we are born with, and it's set up. So when we feed our body cannabinoids, whether that is THC, which is going to get you high, or CBD, which is going to be non-psychotropic, they have different interactions and effects on the body. So to explain it as simply as possible, CBD attaches itself to the cannabinoid receptors, the endocannabinoid receptors, in our body, called CB2 receptors. So they are mostly located in our within our gut and our immune system, and then secondly, most abundantly within our skin. So when we are applying it to the skin, we have thousands of receptors there ready to work, interact, and exchange information with the CBD when it's applied. So what we know so far from the studies is that it is an extremely good antioxidant. So where we would reach for a vitamin C or a vitamin E in our skincare range, CBD is a stronger antioxidant than both. So that could be really good for like antioxidants and aging, etc. It's obviously displayed benefits of being analgesic as well, which is pain relieving. So although we don't claim any of our products are medical, these are just what we've seen from results so far, and that is actually compared to and studied against non-steroid anti-inflammatory creams, and that is compared against all other cannabinoids as well. So if you're looking at cannabinoids such as THC or CBN or CBD, and then even over the counter anti-inflammatory non-steroid creams, CBD comes up as the most anti-inflammatory. So it's got like a range of benefits which our skin is ready to absorb and interact with.
Yeah. And even today, I was reading an article with, quite a lot of the television doctors. They quite write pieces in the media, and there was a really interesting one today, and I think it was Dr. Zoe, and she was saying that even though your doctors, they are basically detectives, and we all need to be able to speak with our doctors about our health concerns. But she said you've got to remember that your doctor doesn't have the answer for everything, and the medical profession doesn't know it all, and they're still learning. So I'm saying this isn't a medical treatment, and it's not. It's meant for the skin, and it's meant to aid, work everything together. I always say, like the holistic, treat everything holistically, treat the body as a whole. I think it's really important that you're saying this and you're doing this research from your own point of view, because when you've got the medical profession openly admitting that they can't have an answer for everything, and then you've got someone like yourself saying, well, here I am going through my thing and I'm figuring out my path and I'm creating these products, that's really reassuring for us when we might be at the earlier part in the journey, or even just wanting to look after ourselves for a variety of reasons. Is that one of the reasons why you wanted to start this too, not only to help yourself, but also because, again, you realised that the doctors don't know it all and you knew that you could actually help yourself?
Absolutely. And I think it comes back to largely, again, very much growing up in a holistic, quite natural. I mean, I come from a very large family. Everybody is vegetarian. We all grew up with homeopaths. And my mum was like making our skincare at home. And, that's just kind of like what I grew up with. Yeah. So it was always quite normal to me. So then when I was diagnosed, and then I started to talk with my doctors, my neurologist, about potential treatment plans and potential treatments that weren't necessarily recommended in the booklet that they give you, they were not open to any of these discussions.
Yeah.
So I remember like 5 years ago, and I was like to my doctor, oh, like, should I look at my gut health? Should I check for leaky gut syndrome? Should I check for, any infections? And she was like, no, it doesn't make any difference. That's not something we look at. And then we spoke about it again the other day, because I was like, oh, I basically haven't had any new lesions since I healed my gut health. And she was like, yeah, no, there's loads of possibilities coming out about that actually. And it's something that we're getting more kind of like, recognition into, and the connection between the gut and brain axes. But I said the same thing to her 4.5 years apart, and her answers were very different. And I thought, thank God I didn't just take what she said for as gospel 4.5 years ago. Otherwise I wouldn't have gone through that journey. So I think it was very hard for me to go against my doctors and my neurologist with what they wanted.
Mm-hmm.
But I also felt that then it basically just showed to me that there needs to be a better interaction and a better bridge between holistic therapies and mainstream medicine. Because this is why people lack confidence with their doctors, because they are often not heard, they feel like they're not seen, and they feel like they are, their personal research is not as adequate because they don't hold the title of doctor. And I feel, that is kind of what is essentially making patients lack faith in their doctors. And I have like 3 of my very, very good friends are doctors, and we have this conversation all the time, because they are like, what is it that makes kind of people have distrust in us, basically? Or like, how can we learn and be better to make sure that our patients feel comfortable with exploring all avenues with support?
Yeah. And there is definitely a divide. I think you probably experienced it too. I was diagnosed with underactive thyroid last year, and touch wood, it's been okay. Some people have that terrible experience where they're undiagnosed for years. I was very lucky that about 5 years ago, I happened to get some blood tests, and a doctor said to me, you've got the antibody for thyroid, you will go underactive at some point. So I was on the lookout. But I've also spoken to some doctors subsequently, once it did actually kick in, who don't want to hear what you've got to say about your own research. They're just not interested. And you'll say, oh, it's exactly what you said about the gut. I do believe that in 5 or 10 years, everybody's going to be saying, why did we not understand how connected the gut is with all these different ailments and issues? But you definitely some that get it and some that don't. So what you're saying really speaks to me, because I do think that it's up to you now to be given whatever your health diagnosis is at that moment, be given the information from the medical side. And I really like the fact that you're telling me that from day dot you were brought up with the holistic point of view, homeopathic, everything about that. You were able to take that information from the beginning.
Yeah, and I think like I also like to like make it very clear, like I am not against allopathic medicine. Like I'm not against Western medicine. Like it's totally saved my life before. I had meningitis, septicemia. I was in intensive care. Like I've been so ill, and Western medicine has saved me, and it saved family members. That have had cancer, or it saved when we go through, when people are having babies and stuff like that, and like how the Western medicine can support them. Like I think it is so important. For me, I just want there to be a better bridge between allopathic medicine and holistic medicine, and then also the recognition of personal journeys, and then not to totally discredit anecdotal experiences, because that is the issue. They don't take those into consideration when considering what is a good form of medication. And if you look at people with MS and people that do, say for example, like ketogenic diet or intermittent fasting, they are much more likely to not suffer from symptoms or for the disease to progress as quick. But the doctors will never ever tell you this, and they will never have that discussion with you, which is my pain point essentially.
Yeah, no, couldn't agree more. I always think your health is like a jigsaw puzzle, and you've just got to take from everywhere to get the correct fit for you. And I think it's fantastic.
And 100%, I agree.
Well, that leads me on to, I find you very inspiring. What you're telling me that you do is phenomenal. There's a lot of people who would think, oh, I'd love to do something like that, but they don't actually get up and do it. So who would you say does anyone inspire you, or do you just get on and do it yourself? Is there someone you look up to in business or even in the family that just you think that's the person that, yes, they motivate me?
Yeah, I think there's a couple of people that motivate me, especially I think within my family, for example. So both my parents were not in full-time jobs when I was growing up, but they did different odd jobs and did different things to allow them to have the freedom to be able to provide for us, but then also spend a lot of time at home.
Yeah.
And I think that has influenced my view of what a normal job should be, and the faith that you can work for yourself and make things work and provide for your family. And also, I have an uncle who I used to work for, actually. I worked at his company for several years, who was the CEO of my recruitment company. And he was the CEO of a publicly listed company, and he did not have a degree. So I have always, and I didn't have a degree either. So I have always had examples around me of not having limiting belief that not having certain things can stop you achieving great things. Or not kind of like, really designing your life exactly how you want it to be. So I think like I wouldn't automatically say like, oh, they're my inspirations, but they are definitely like my initial influences in life that have equipped me with the tools to allow me to do what I do now. Inspirations, at the moment, I'm just really inspired by female founders in the tech space, particularly that are leading femtech and really making differences for women's lives. Like I'm into like the LV technology to make for the breast pumps that are existing, for the app Peanut that are connecting women in pregnancy together and answering questions for each other. I'm really interested in a lot of stuff that's going on around like endometriosis and just in general like female tech, basically. So they are the people that are inspiring me at the moment.
And it's a very exciting time. And I suppose in skincare as well, it can frustrate me that sometimes people give the word natural a hard time, almost as if something's natural, then it can't be as effective as something that will be filled with stronger chemicals. What do you have to say about that? Because you've explained really clearly about the CBD element and everything it does. So do you ever find that people are quite hard on that word, or have you actually found it to be the opposite?
No, definitely. Like, so when we're looking at working with certain dermatologists, they are like, this is not really on brand for me because it's too natural. But first of all, like everything's a chemical, like water's a chemical, every ingredient is a chemical. So I think that kind of word in general has like got a bad rep, a bad term. I think what we have done and what we're trying to do is highlight the fact that we use clinically proven plant-based ingredients that have the same effect, basically. So, for example, like our daily defense serum, we have marine vital C, which is it's like a marine algae extract. It's clinically proven to be anti-pollutant, so it's going to protect your skin from blue rays from looking at your computer, and everyday antioxidants, which in turn is going to stop aging, basically. So that is a really good clinically proven anti-aging active. but because of its origins, then sometimes people have a hard time taking it as seriously.
Yeah.
And I think that is part of the target. What I wanted to do when I started this was, I want to use like quote unquote quote natural skincare, but I also want it to work because I also want to look 25 forever. And I also, I also want to look as young for as long as possible, but I also really want to preserve and protect my skin, most importantly. And I want products that are going to work. That is one thing that actually like led me away from using like the natural products that I'd grown up with, was that they were all very basic. So we would just have like shea butter, jojoba oil, like neem oil. We would have like, which are all really beautiful oils with amazing potential and benefits, but are they proving the same level of efficacy as other products? No, they're not. And I want my products to prove the same level of efficacy and have clear science driven results, which can be done through using natural products as well. But you just have to work a bit harder to find them.
Yeah. So I suppose the answer to anyone that, and you know what it's like, I've got the YouTube channel. There are some people who just want to argue. So I suppose in that case, if anyone wants to argue, why don't you try the product and then you can see for yourself?
Yeah, I think that I have just like basically accepted that there is always going to be someone that will want to argue or see things a bit differently, and ultimately there's nothing you can do about it.
Oh, exactly. So, that does lead me into an area which I love about the information that you give us with the products, and it's what you recommend that we do alongside taking it, and it's meditation, positive affirmations, and conscious breath work, which I couldn't agree more with. And I do feel that you tend to discover these things when you were meant to, if you know what I mean. If you some people say, I can't meditate, I've tried, it doesn't work for me. I always feel that it clicks when it was meant to click. So do you feel that a lot of people might come to the brand when it was actually the right time for them, and then they understand everything that goes with it?
Yeah, I definitely think so. I think, I definitely think so. I think there are certain things that happen in our life that drive us to these things. So for me, it was on my wellness journey, but I wish that it didn't take me to being diagnosed with MS to work all of these everyday practices into my practice and into my self-care routine. And I think that it is, as women as well, considering like how much we go up against every single day, that having 10 minutes in the morning and 10 minutes in the evening to use your self-care routine as moments of time for yourself and self-priority are really important for both our physical and mental preservation and health. So I think that is what we try to convey in our products, and why we've sort of add that additional information in there as well, because it's something that you're going to do every day. Mostly you're going to do it twice a day, and it's just, you're probably not going to do it while you're cooking or while you're cleaning, or like, you're not going to do it. You have to be pretty focused and pretty present to do it. So it's a really good time to work in positive affirmations, conscious breath work, just really showing yourself some love. And I think that self-love is so important. And I just want all women to feel empowered within themselves as best as they can. And this skincare range is like my way of sort of sharing that with other women and hoping that it has some positive impact.
Well, even some of the ingredients in the Daily Defence Serum, when I tried it, I got a lovely initial hit of the cucumber seed oil, and then I could see behind it the rose hip. And I know that a lot of people do it, and I'd recommend it if they get a chance to try the serum. Once there's a little bit of product residue on the palms of your hands, breathe it in. It smells amazing, and it actually helps with that entire relaxation process. So you're getting that sort of multi-layered effect straight away. So and what I did as well was I kept going back to the smell, because it's got that lovely just light, lingering scent. So for the next hour or so, I just kept having a little smell going, that's lovely. And I do think that all connects in. And if you feel good and you feel like you've done something good for yourself, that it all just starts to change your mood, change it. And then it's that knock-on effect, isn't it? It's just getting that right frame of mind.
Definitely. We spent a whole day going through lots and lots and lots of different scents for these products and the aromatherapy behind them. And they were all very purposefully chosen. And I wanted to add some low levels of essential oils, so it wouldn't necessarily be like reactive or like produce an allergic reaction for some people or skin sensitivities, but there was still that slight scent there. Then also having the natural oils come through, so the cucumber seed oil I think is such a fresh, beautiful scent that is so invigorating for the morning, that it's kind of like waking your spirit up. And it has that kind of like that very, very fresh scent that you're going to associate with the morning time and your morning routine. And once you actually once you're like having that smell, it's like muscle memory for the brain. So you're going to remember. For me, when I use the product, I remember as soon as I smell it, I'm like, okay, let me deepen my breath, let me say my positive affirmations, let me be conscious in what I'm doing, let me massage the the sides of my jaw to release some of the tension. So like that smell just works my muscle memory. And it's the same as our night oil as well, where we have like, it's a bit heavier, it's a bit richer, and it is really kind of like soothing for the night and going to kind of get you into that nighttime sleep mode for repair and recovery.
And what other products have you got in the range, in case anyone, and actually tell me the name, the full web address as well, so people can have a look.
So our full web address is ohana-cbd.com, and it is Ohana CBD on Instagram. And we have 3 products that we've launched, which is the Daily Defense Serum, which is the anti-pollutant very lightweight day oil. We have the Night Repair Oil, which is our bakuchiya oil and CBD combination for nighttime repair on the skin. And then we also have the all-in-one Wonder Balm, which is a really, really beautiful multi-purpose balm, which can be used for anything from muscle recovery to dry skin to, we have a lot of people that use it for eczema and psoriasis. So for example, like in our all-in-one Wonder Balm, with the clinically proven active that we have in that is called DM-Elective, and that is proven to be double anti-inflammatory and double antioxidant. And they've actually, most of the studies done for that is against rosacea. So it's clinically proven to help against rosacea as well.
Oh, fantastic. That's such a common one. So many people, some people, obviously you'll know this, have rosacea. They've just always had it. But it's really, I find that when people maybe get into their 30s and 40s, they'll come to me and they'll say, what is this? They don't even identify that it's just triggered within them. So would you recommend that as something, if it might just be, it's almost appeared just with age, and you can just start to deal with it, incorporate that into your skincare?
Yeah, I think so. I think that is what, a lot of our customers use that for, is rosacea. But then also it's like dermatitis, eczema, psoriasis, any kind of like skin inflammatories. The Daily Defense and the all-in-one Wonder Balm in particular have been proven to be very effective against that from our customer base. And our repeat customers actually so high because it just works so effectively for them. But then also, funny enough, actually, it's like I've seen a lot of people developed rosacea during menopause as well. So we have like a really, really big spectrum of ages that are interested in this as well, because if you're developing rosacea due to the menopause, it's a really great time to try a CBD topical as well for that.
Fantastic. I think just to finish off, if someone hasn't been on the website already, I would recommend they have a look, because it's not just the products. You've really covered everything. You've got interviews, you've got lots of tips. If 2020 has been a very strange year for a lot of us, it certainly looks as if it's been an exciting one for you. So have you got plans to take the website further? Got ideas for 2021? Any?
Yeah, definitely. We have a lot of development plans for the website that we will continue to do throughout 2020. So we will continue with our content. We are building in more skincare content as well. So we've covered the CBD part quite well, but now we will move more into the skincare piece. And I think in 2021, it is probably a couple of more SKUs for us, actually. There are some other products that I really want to bring to market that I'm quite excited about. So, yeah, we will probably do that next year as well, which will be good.
Well, all the best. It's honestly, it's such a lovely product. I think your story is so inspiring. It's clear that you are so focused. So if this is what you can create in this space of time, I'm looking forward to seeing what you do next.
Thank you so much. Thank you.
Thank you so much.
And thank you for having me today. It's such a pleasure speaking with you.
I've loved it. Thank you so much.
All right, take care. Thank you.
Bye. And that's our chat. I hope you enjoyed it. I found Jasmin's story so inspiring, and even though I've been 20 years in this industry, it just shows that you never stop learning. I learned a lot during our interview. I understand a bit more about CBD within skincare. Obviously, there's so much to learn. So remember, you can go onto the Ohana website. You can see for yourself. There are always new articles going up. There's always learning within the community area. And I am looking forward to seeing exactly what the brand does as the years go on. So as always, I hope you enjoyed. Have a wonderful week, and I will see you again soon.